Hey nurses, welcome back. Today's topic, myocardial infarction, or MI, a critical topic for NCLEX and patient care. MI, often called a heart attack, is when blood flow to the heart muscle is blocked, causing tissue damage. It's a life-threatening emergency, and nurses play a huge role in saving lives. We'll use the ADPIE framework, assessment, diagnosis, planning, implementation, and evaluation to break it down, plus share NCLEX tips to help you shine. Let's get started. First up, assessment. When a patient has an MI, you're looking for classic signs like chest pain, described as pressure, heaviness, or squeezing in the chest, arms, or jaw. Other symptoms include tachycardia, tachypnea, sweating, nausea, or anxiety. Some patients, especially women or older adults, might only show fatigue or shortness of breath. Key diagnostics: a 12-lead ECG is critical. Look for ST segment elevation in STEMI or T-wave inversion in STEMI. Cardiac biomarkers like troponin I or T rise within 3 to 4 hours and confirm MI. For example, imagine a 55-year-old male with chest pain for 30 minutes. You'd check vitals, auscultate for murmurs or crackles, and get that ECG stat. Next, diagnosis. MI happens when a coronary artery is blocked, often by plaque rupture, thrombosis, or spasm, cutting off oxygen to the heart muscle. Nursing diagnoses might include acute pain related to myocardial ischemia, decreased cardiac output due to impaired contractility, anxiety due to life-threatening illness. For a STEMI, expect ST segment elevation and possible Q waves on the ECG, indicating a full-thickness infarction. NSTEMI shows T-wave changes without ST elevation, often a partial thickness injury. Knowing the location, like anterior wall from left anterior descending artery occlusion, helps predict complications like heart failure or dysrhythmias. In planning, we set measurable goals. For MI, priorities are: relieve chest pain within 30 minutes, restore adequate cardiac output, aiming for stable vitals, e.g., BP, greater than 90 millimeters of mercury, prevent complications like heart failure or ventricular dysrhythmias. Picture a patient with STEMI. Your goal is to ensure timely reperfusion via PCI or fibrinolytics, maintain oxygen saturation above 90%, and reduce anxiety through clear communication. Planning also includes preparing for potential complications, like cardiogenic shock or ventricular septal rupture. Now, implementation. Nurses act fast. Administer supplemental oxygen to keep SpO2 above 90%. Give aspirin, 162 to 325 milligrams, chewed, for antiplatelet effects, and sublingual nitroglycerin, 0.4 milligrams every 5 minutes, up to 3 doses, for vasodilation. Start IV morphine, 2 to 4 milligrams, for pain if needed. Monitor the ECG continuously for dysrhythmias like ventricular tachycardia. For STEMI, facilitate rapid transfer to a PCI-capable hospital. Time is muscle. Administer heparin or beta blockers as ordered, and educate the patient to avoid the Valsalva maneuver to reduce cardiac strain. A calm environment also helps lower stress. In evaluation, we assess if our interventions worked. Is the patient's chest pain gone or reduced on a 0 to 10 scale? Are vitals stable with no signs of hypotension or tachycardia? Check the ECG for resolving ST elevation and monitor troponin levels to confirm reperfusion. Look for complications like pulmonary edema or new murmurs, which could signal papillary muscle rupture. For example, if a patient's oxygen saturation improves to 95% and pain drops to 0.2, your interventions are effective. Adjust the plan if complications arise, like starting an ACE inhibitor for heart failure prevention. For NCLEX prep, remember, time is muscle. Prioritize rapid ECG and reperfusion, PCI, within 90 minutes, or fibrinolytics within 30 minutes for STEMI. If you see ST elevation in leads V1, V4, think anterior wall MI, high risk for heart failure. Watch for inferior wall MI, leads 2, 3 AVF, causing bradycardia due to right coronary artery occlusion. NCLEX style question. A patient with chest pain has ST elevation in leads V3, V4. What's the priority? Answer: notify the physician and prepare for PCI. Focus on ABCs, airway, breathing, circulation, and memorize biomarker timing. Troponins peak in 3 to 4 hours. That's a wrap on myocardial infarction. You're now ready to tackle MI in clinicals or on the NCLEX. Drop a comment with your favorite NCLEX hack, and I'll see you in the next video. Stay heart strong, nurses.